Does your baby spit up after almost every feed? Maybe the milk comes out suddenly, sometimes thick, sometimes watery, sometimes just a few minutes after feeding. Many parents feel scared when they see this. It looks unusual, and it feels like something is wrong. But in most cases, it is completely normal. Spitting up is a common part of a baby's early months. And today, we will talk about the real reasons why it happens. More importantly, we will explain the warning signs you should never ignore, so you can understand what is normal and what needs attention. Before we talk about the main causes, it's important to understand how a newborn's body works. A baby's stomach is very small, almost the size of a tiny egg. Their muscles are still soft and not fully developed. The valve that keeps milk inside the stomach is weak in the early months. Because of this, milk can easily travel back up, especially when the stomach becomes full. This is natural. It happens to almost all babies. Their digestive system is still learning, still growing, and still getting stronger. Knowing this simple science helps parents stay calm and understand that spit up is often just a normal part of a baby's growth. Cause number 1, overfeeding. One of the most common reasons babies spit up is simple overfeeding. Newborns have very small stomachs. They can only hold a small amount of milk at a time. But many parents worry that their baby is not getting enough and offer more milk too soon. Sometimes the baby continues to suck, not because they are hungry, but because sucking feels comforting. When the stomach becomes too full, the extra milk has nowhere to go except upward. This creates pressure, and the milk comes right back out. Overfeeding also pushes air bubbles upward, which brings milk along with them. This can look scary, but it is usually harmless. Understanding your baby's natural hunger cues and giving breaks during feeding can reduce this problem. Remember, babies know when they are full. Slower feeding, gentle pauses, and watching your baby's signs can make a huge difference. Cause number 2, air swallowing, gas. Paragraph. Another very common reason babies spit up is swallowed air. Babies can take in air while crying, during fast feeding, or when the bottle angle is too flat. Breastfed babies may also swallow air if they latch quickly or if a fast letdown happens. When too much air goes into the stomach, it creates pressure, just like blowing air into a small balloon. When the baby burps, cries, or moves suddenly, this trapped air pushes the milk up with it. This is why many babies spit up right after burping. Gas can also make babies uncomfortable, causing them to squirm or arch their backs. This movement brings milk upward more easily. Feeding slowly, keeping the baby calm before feeding, and burping during and after feeds can help. These small adjustments reduce swallowed air and lower spit-up episodes significantly. Cause number 3, immature stomach valve, reflux. This is the number 1 reason most babies spit up. At the top of the stomach, there is a small valve called the lower esophageal sphincter. In newborns, this valve is still soft and weak. Its job is to keep milk inside the stomach. But in early life, it cannot close tightly yet. So when the baby lies down, moves, or even takes a deep breath, milk easily slips back up. This is called physiological reflux, and almost every baby experiences it. It is not dangerous, and it usually gets better as the valve becomes stronger. Most babies outgrow this by 6 to 12 months. As long as the baby is gaining weight, feeding normally, and seems comfortable, this type of spit-up is simply a part of normal development. Understanding this helps parents relax and avoid unnecessary worry. Cause number 4, milk sensitivity. Some babies may have a sensitivity to certain proteins in milk. For formula-fed babies, the issue is often cow's milk protein. For breastfed babies, something the mother eats may pass into the milk and cause mild reactions. This sensitivity can irritate the baby's stomach and intestines. When this happens, babies may spit up more than usual, seem fussy after feeding, have gas, or develop small rashes. Not all spit up caused by sensitivity is serious, but it can be uncomfortable. The good news is that mild sensitivities often improve as the baby grows and the digestive system becomes stronger. Discussing symptoms with a professional can help identify if the baby needs a different formula or if the breastfeeding mother should avoid certain foods temporarily. Cause number 5, incorrect feeding position paragraph. Feeding position plays a bigger role than most parents realize. When a baby drinks milk while lying completely flat, gravity cannot help keep the milk down. As a result, it is easier for the milk to flow backward into the throat. Fast feeding, slouching positions, or holding the bottle too horizontally can also cause similar issues. Sitting the baby slightly upright during feeding gives the stomach more stability and reduces pressure. Keeping the baby upright for a few minutes after feeding allows the milk to settle. These simple steps can make a big difference in reducing spit up. Many babies spit up less just by adjusting feeding angles and slowing down the bottle flow. Small changes often create big improvements. Many parents panic when they see spit up, but most of the time it is not a sign of illness. Normal spit up looks like milk, sometimes mixed with a little mucus. The baby stays calm, feeds well, and continues to gain weight. The spit up amount may look large, but it is usually much less than it appears. Babies who sleep well, smile after feeding, and show no discomfort are usually fine. Spitting up becomes less common as they grow stronger, sit up, and begin solid foods. In most cases, spit up is simply a normal part of early development. There are some signs parents should never ignore. If the spit up shoots out with force, like a fountain, this may be a sign of something more serious. If the baby is not gaining weight, refuses to feed, cries in pain, or seems uncomfortable after every meal, it is important to get help. Spit up that looks yellow, green, or bloody should always be checked by a professional. Difficulty breathing, choking, or constant coughing after feeds also requires attention. These signs do not mean something is definitely wrong, but they do mean the baby needs proper evaluation. Early action helps ensure the baby stays healthy and safe. Most babies spit up. It can look messy and worrying, but in so many cases, it is harmless. You are not doing anything wrong. Your baby's body is learning and growing every single day. Now that you understand the real causes and the warning signs, you can care for your baby with more confidence and calm. Remember, a little spit up is part of the journey, and most babies outgrow it completely with time.